Hello and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and today we are talking about the biggest step, the next biggest step to put patients first in your practice. This episode is brought to you by Tooth Apps Connect, the dental health information exchange, and we're going to talk a little bit about that today. But what does putting patients first mean? Well, it's what this podcast is about. I wrote the book, The Patient First Manifesto, about bridging the great disconnect between dental patients and your practice and dental practices. But I wanted to take a step back today and talk about what putting patients first means. Ultimately, one of the major tenets there is a podcast about this that I did a few months ago about the term patient partnered, partnering with our patients, right? That I believe is a key tenet to putting patients first. That was not explored, frankly, that much, a little bit in this book. But I think that's the next big step that we can do. But how do we do it, right? How do we actually partner with our patients to provide the best quality care? And what does that mean? What does that mean? I think it is key because co-diagnosis, I don't think as provider makes a ton of sense. Okay, co-diagnosis means that you and the patient together are coming up with a diagnosis. Why doesn't that make sense from a dentist perspective? Because I am. Because let's face it, as a patient, you are never going to have the volume of information that a dentist does, and hopefully not. I mean, there's reasons why I went to dental school, and maybe you are a plumber or you are a business executive or you like, you roof houses. Look, I'm not going to be the best at roofing a house. So why would a patient be the best at diagnosing their oral care, right? So co-diagnosis. Now, of course, having the patient and having a conversation with the patient to collectively come to a patient partnered diagnosis and treatment plan is obviously important, right? But it's more partnered diagnosis, acceptance, treatment planning, because what are we looking to do? We're trying to take the knowledge that the dental team member has, the hygienist, the assistant, the people that are dealing with and have the experience and the education about dentistry, to deliver it to deliver dentistry and diagnosis, treatment planning, and treatments from the what the patient wants, not imposing our perspective on patients. So partnered diagnosis, not a co-diagnosis, a partner diagnosis, not imposing what we would want to do, but having a conversation with the patient so that we're both educated on what we're both seeing and thinking about from the patient's perspective and from the dentist perspective, so that we can come to a conclusion as what's best for that patient. Because let's face it, not no two people would do things the same. If you post a picture of a tooth and a dentist online says what they did to that tooth, what their diagnosis, what their treatment was, chances are you'll have 10 dentists that would come up with something else, right? And that really doesn't have to do, they have the same knowledge. Usually they agree on the extent of the caries there's the facts are the same. What's different though is that some people would handle it differently because let's face it, we're practicing dentistry. There's not strict guidelines for everything we do because some of the things that we do come down to basically what preference is. And we don't know what the patient's preference is unless we partner with them, unless we ask them and we come to a conclusion. So what we're looking, I believe, as a dental team member is to deliver information, take the knowledge that we have that the patient doesn't have because they're not in dentistry every day, and have the conversation, partner with patients so that they can determine what's best for them. Now, obviously, we can influence them, and if our goal, as I believe it is for as dental professionals, is to increase the oral wellness of the population, we can help them get to a higher state of oral wellness, right? But that's really no different than anybody else that's trying to influence somebody else to do what they think is in their own best interest. Like if you're trying to parent your kids and you want them to, I don't know, have better wellness or study more, right? It's trying to impart our information without judging or transmitting too much of our preferences onto the patient. So like to think about it more like guiding patients in their oral wellness, not forcing them, right? Because as soon as there's lots of research studies show about how dental patients feel like they're lectured at the dental practice, right? That is not partnered partnering with our patients. We want to guide them, not force them, right? So, what's the next big step in allowing this to happen and giving patients the information without judging, empowering patients to make decisions what's in their best interest with the knowledge and trying to transmit our knowledge and experience to the patient. I think we all need to have the same information, right? If you think about it, one of the big differences between the dental patient and the dental practice is the information we have. Now, oftentimes that might require a second or third opinion, which I think we should welcome. If when a patient says, "I think I'm going to get a second opinion," I go, "That's fantastic. You are a well-educated healthcare consumer, right? Most people don't just go see, if you're going to buy a car, you usually just go to one dealership, look at one car and buy it, right? You kind of shop to see what's best for me. And I think the same thing is usually true in healthcare. One thing I know is that no one has ever said to me, "Boy, I really regret having a second opinion." So seek it out. The problem that we have though in dentistry right now, and the reason why I think this is the next biggest step, is that we don't really have access to that information, right? If we're truly going to let our patients partnering with our patients so that they have the same information that we have to allow them to have access to their dental records. And let's face it, we don't even have good access to our own dental records, meaning the dental practices don't have access to the records that they own in their practice and that belong to the patient legally. That's really, as if you've been paying attention to the Patient First podcast lately, that's really what my mission is right now, because I do think it is the biggest next step in partnering with our patients and getting them the health care that they deserve, their oral wellness care that they deserve. It's by giving them access to their information, all of their electronic dental records, just from their mobile device. And the only way we can do that is if we have access to it ourselves, which, let's face it, it comes in all sorts of ways. There's a diagram that I have here which shows, this is from a health information exchange, and Tooth Apps is the dental health information exchange, what we call connected dentistry, right? And at the middle of it, and this is a Google image of what dental health information exchange, or of a health information exchange. Who's in the middle of it? Obviously, it's the patient. Why? Because this is their information legally, right? They should have their progress notes, anything that happens with the specialist. Look, the specialist should have access to the same progress notes that the general dentist does. Why don't they? Why don't they? It's because we are using archaic systems, right? Let's fix it by connecting the dots here so that everybody has access to the same information about the patient. You can't make educated decisions without the education. And that education comes from what? It comes from information. So, key to delivering high quality care is information. Information leads to diagnosis, right? Accurate diagnosis is the first step to providing high quality treatment. But before we can even make an accurate diagnosis, we have to have the information. And nobody in dentistry has that today. They have partial aspects of the patient, right? And nothing is wrapped together such that the dental practice and the dental patient can have access to that data. That is what Tooth Apps brings. It's connected dentistry through having a dental health information exchange that connects all the disparate systems that are that collectively make up the electronic dental record, such that the patient legally owns their information and the practice also has access to get all the information, past, present information, from wherever it lives. If it's in the practice management system, let's say it's the patient demographic information, whether it's an imaging platform that's in the cloud, we can pull that in. It's vitally important that I think we get this right, because it is, I believe, to be the next big step in patient care. It's gonna be, I think, the biggest unlock in in providing higher quality care, lower cost of care, and innovation in dentistry. Because this having access to all of the information it just, think of the tools and what we can do when we actually have all the information about the patient. And by all the information, I mean the medical records obviously coming in too. If a patient, we all know patients lie when they go to the dentist, because they don't think, look, the dentist doesn't need to know I have diabetes, right? Of course we do. Of course we do. But we know that the patient doesn't. That's part of the knowledge gap between somebody who's gone to dental school and a dental patient. They don't know that diabetes is hugely significant. That diagnosis of diabetes, that condition, vastly affects your oral wellness. But the patient can't be expected to know that. But what we can do, we can bring that information from the health system, so that when you pull up your medical history within your practice management software, or in this case in Tooth Apps, you'll be able to see, oh, the patient marked that they don't have diabetes, but 2 months ago they were at the physician and got diagnosed with diabetes. So then you can have the conversation with the patient, right? And then you can explain the connection between diabetes and oral wellness, and that will open up a conversation for millions of people that wasn't possible yesterday. So join us, join the cause. Go to toothapps.com. That's what Tooth Apps Connect is all about. That's what connected dentistry is all about. It's about putting the patient first, putting them in the center, so that we can do partnered dentistry, not just partnered with other dentists, which is obviously vastly important, not just partnered with our physicians, our colleagues on the medical side, but partnered, most importantly, with the patients at the center. Thank you very much. Thanks for joining me again. Always appreciate it. If you have questions, comments, suggestions, if you think that giving patients access to their dental data is dangerous, I would love to hear that. I've heard it before, and I would love to have the conversation. So like, comment, subscribe, and show up next week. I'm happy to see you here next week on the Patient First Podcast.